Yeah, I got you. Fantastic.
Hi.
Thank you so much for coming, Shaista. I know you sent us some details. They're a little brief. So we know that you started in 2019. We know that you're a current trainee ST1, but I do know from some of the chat that we've been having that you do a lot
Yeah.
of work for IMG doctors around O&G, getting in. We're going to share some of your blogs and some of your Facebook groups and things in the chat whilst you're doing your talk. But thank you so much for coming on board and covering a topic that we get a lot of questions about, and to be honest, that we don't know very much about. So really grateful to have you here to try and fill in some of those gaps for us.
Thank you for having me. Is my voice clear?
Yeah, all is good.
Awesome. So, hi everyone. Thank you for being here. Just to begin with, my name is Shaista Anwar. Some of you might know me from the other name, Shaista Malik, which is on Facebook. I'll start my session. I'm doing my ST1 in Obs and Gynae. I just started in August 2019. So I'll start from the beginning. So basically, I'll be talking about Obs and Gynae, but I'll briefly touch other aspects of Obs and Gynae. My topic won't be specifically for Obs and Gynae trainees, but I'll slightly touch for other F2s doing Obs and Gynae as a rotation, or GPST who are going to touch Obs and Gynae for their 4 months of rotation. And usually they are very scared of being in Obs and Gynae. So I'll touch my career pathway, and I'll also touch how Obs and Gynae is for a junior in there. So points for today, I'll briefly talk about me and some facts about Obs and Gynae, covering a junior's life and career and application and everything. Then we'll touch the application process, which is more like same for other specialties. MSRA, of course, as like others, it's not anything different, and some important bits about interviews. And then I'll share some important links, which are basically from RCOG side, because whatever you want to do, you need to have good information, good homework for what you want to do in future. And you should read about the stuff. Most of the questions which we have commonly in our mind are answered from those sources, which are all over the internet. When I started my Obs and Gynae career, I didn't had anyone to guide me details, because there was no platform as in specific for Obs and Gynae trainees, or there was no one as a junior level who could guide me like what the process is, how your life is going to be and everything. I searched through internet, and those links were very helpful for me. So I'll share those in the end. So about myself, I did my MBBS from Pakistan. It was in 2016. So I'm kind of a pseudo fresh graduate. I did my foundation year / house job in Pakistan. In 2018, I finished it, but by that time, I already knew that I wanted to move out of Pakistan and start my career in UK or some other country. I was sure about Obs and Gynae, but I would say like 80% maybe. But I didn't know how to apply, what are the process and everything. So I did start my PLAB journey that time, and I was done with my PLAB 1 in my house job. I applied for PLAB 2 in 2018, but unfortunately, I could not pass my first attempt. Why I'm highlighting that point here is that most of us stop right there and then and thinking that it's going to be a hard job in future, but nothing is impossible if you are keen to do so. So I did fail my PLAB 2 with very bad scores, and I was kind of depressed and everything, but I took a break. I start planning things. I read about them. That's what I say, that do your homework. Whatever you want to do, don't rush. UK is not about rush. So I took a break. I did my PLAB 2. I did my PLAB 2 in, if I'm not wrong, May 2019. And I got my GMC registration probably in August or July, if I'm not wrong, July 2019. Then I started applying for a job. For 3 months time, I didn't get any job offer. I didn't get any interviews. Again, I got depressed and thought there are a lot of hurdles. But then I realized there are a lot of things which we are missing on the scale. Because when you are coming as an IMG, we're not really sure how system is different than what is in back home. So I worked on those things, got my first job as an F1 trust grade, which is a non-trainee post in neurosurgery. So I was keen to do any surgical jobs because I was keen to go for Obs and Gynae. So it's not a necessary thing, But what's important is you know your bits. I wanted to get adjusted in the system. It was in neurosurgery F1. I was doing most of like the ward-based job, no on calls. It was fine for me as a beginning thing. So from December 2019 to September 2020, I did that job. I did it, and then in that job, I realized that this is time to move on. Now I'm done with my F1. I need to get up. So I wanted to do any ST1, F2 level job or junior clinical fellow, whatever, as a non-trainee job. But to be clarified, I didn't opt for training job that time. I could have done that right when I came in December, because your application process for training starts in December, but I was not in that rush. I wanted to work on my things first and that can get into the system. So I gave my second interview for other jobs, emergency medicine, rotational medicine, and obs and gynae as well. So now to highlight here, there are obs and gynae non-trainee jobs as well. People say there are not too many jobs. I would say there are jobs. You just need to look for them. So I did my second job in obs and gynae as an F2. Again, it was not a very ST1 kind of job, but it was a small unit, so I could learn few things about obs and gynae life, work and life balance, and other things. So I learned quite a lot of things from there. While doing these two non-trainee jobs, I worked on my profile because I was reading about how to get into obs and gynae, and I wanted to check my list that I'm fulfilling those criteria. I'll talk about them when I'm coming to interviews or specialty training application, that how did I completed that checklist. Then in that year, I completed my MSRA, I did my interviews, I got my offer, I planned to move out, and then I started my next job here in East Midlands as an ST1 Obs and Gynae, which was started in August. So I'm quite new. Right. So some facts about Obs and Gynae. Obs and Gynae, you can do a training job or you can do a non-training job. There is no hard and fast rule. With training job, it's a 7-year training program. You will be ST1 to ST7. ST1, ST2 are like a junior SHO, junior doctor. ST3, you are a junior registrar. ST5 or 6, you are above the junior registrar level, and now you are senior registrar level. And by ST7, you will complete your training and you will be a junior consultant. So if you can see, this is a long journey, but it can be flexible. You can go for less than full time. You can complete as you want, but it does require a lot of commitment. It does require that you understood the system before you are entering in it. The other way is you can go for a non-training job. You can start from ST1, ST2, ST3, but it won't be labeled as an ST1, 2, 3. It will be like a junior registrar level job or a senior registrar level job or a junior clinical fellow job, and then you move on and you will be completing all those things which are essential for a trainee job, but it will be required a lot of commitment from your side because it will require a lot of paperwork, dedicated consultants who can look after your training program, and trust who can offer these things. It's not impossible, but it is not impossible as well. The other thing is you can go for ST1 or ST3 in training pathway. Now, although it's a run-through program, once you have entered ST1, you don't have to compete again for ST3 as in other specialties like medicine. If you have gotten in ST1, which I have, that's more likely that it's more easier. I'll explain why. If you want to go for ST3 level, that's a different scenario. That's a different requirement and prerequisite for that. You need to go for the ST1 or ST3 round application requirements. For ST1, like it says, you need to have a crust form. You need to have your you can't have more than 24 months in obs and gynae experience. Although you can be old enough, but in obs and gynae, your experience should not be more than 24 months by the time you start your ST1s. So for example, people who have done obs and gynae back home, they have 4 or 5 years of obs and gynae, and now they want to start training here. They can't start from ST1. They have to start from ST3 training or a non-training pathway. So a lot of my colleagues who have done 1 year, 1.5 year, they were asking me about that. that's the time when you need to make a plan from beforehand. Because when I started my F1 or F2 job, I knew I can't have more than 24 months of obs and gynae. So I had it planned for my first go, or if I fail, for the plan B as well. With ST1 or ST3, the requirements are slightly different. For ST1, they don't require much of the things from you. What they want is just a junior doctor who is good on his F2 level, and they can have their 12 months or 24 months maximum in obs and gynae, and they don't require MRCOG1. MRCOG1 is desirable but not essential for ST1s. You have to pass your MRCOG1 once you have done your ST2 level. So then you are already 24 months in obs and gynae. So that makes a difference. If you have done MRCOG1 and less than 24 months in obs and gynae, that's fine. But if you have done more than 24 months and MRCOG part 1 or 2 or whatever, it won't count for ST1. You have to go for ST3 then. For ST1, you have other things needed like audits, teachings, but if you are going for ST3, they require a lot of other things because of the competition ratio. For ST3, you require research, you require papers, you require publications, and you need to be very good at what you are. Competition ratio, it is mildly competent field. The ST1 level, you have competition ratio last year was 3.37. A year before that, it was 3.2, if I'm not wrong, or 3 point something. So it's going above. So it is 3.37, still possible, not impossible at ST1 level. But if you see for ST3 levels, it's 14.18. There are not many seats for ST3 levels. The only ST3 level seats are those which are left from ST1 level. So for example, someone starts their career as an ST1 and by the ST3 level, they drop out from the training program. These are the seats which are left for ST3 level. And why do they have ST3 level is because there is a high dropout in obs and gynae. Why is that? Because people don't plan things ahead. They don't know how the work and life balance in obs and gynae is, and then they jump in blindly. And then by year 2, they think this is not for me. I'm not gonna do it, and they drop out. And there's a lot of depression and waste of time. They think about themselves as a loser and everything, but it's not about that. If you plan things smartly, you can do that. As we spoke about MRCOG already, by year 2 of training, you are required to do MRCOG 1. By year 5, you're required to do your part 2. And by year 7, you need to have your part 3, which is spaces. And then you can complete your CCT pathway and you will be awarded with your degree. So timeline, we have already discussed about timeline, that it's very, very important. You plan things ahead. So I started my planning when I was opting from my first job to second job. I started planning then, because then once you start your plan, you need to be sure when is the timeline for your application round, when is going to be your induction for MSRA, when do you need to fill your crust form, and what are the criteria for crust form. Because as we spoke earlier, very detailed about crust form, that you need to be with a consultant who is happy to sign it for you, and you need to fill those things. So for example, if you start any job where you can't do your crest form, then you will be under impression that it's not possible for this round. So you need to be very smart when you start your timeline. Though the post will start, let's say next year, August 2022, but whoever wanted to start it, they should have started planning from August 2021 or even before that. High dropout rate, we discussed that, because work and life balance and how training is, what is required from you and everything, you need to read about that stuff. I will say never jump in any specialty. It's not specific for obs and gynae without reading about it or without doing any taster or any non-training job. I did my non-training job foundation year 2 in obs and gynae, so I knew it that it does match my rhythm. I can do that, so I went for it. But if I haven't done that, for example, I had a taste for medicine as well, but if I haven't seen medicine myself, I would submit both of the application and then I will be confused about it. So it's very important that you understand what you want to do. One of my consultants said a very beautiful thing, that your training is going to be for 5 years, 7 years, but then you are going to be that consultant for almost the rest of your working life. So see yourself as a consultant, where you want to be in that. What would you prefer to be, that consultant, or would you rather be any other consultant whose training is tough for now, but you see yourself in that scenario? So always plan it before you jump for any applications. I know people are very impatient. Once the application rounds are open, they are putting application here and there, and then they're confused once the offers and exams and everything are done, that am I still wanted to go for obs and gynae, or do I want to go for anesthesia? Do I want to go for pediatrics or whatever? So please think about it very detailed. Discuss with any senior, discuss with anyone, and then go for it. And if possible, do a taster week or even a non-training job. But it's not impossible. So working as a junior in obs and gynae, it's for GPSTs as well, or F2s, or whoever is starting their job as a non-trainee as well. Your day is very dynamic, although it is in whenever you're working in a healthcare system. But I would say, for example, if you're doing in obs and gynae, it's not like you're coming for a day and you're gonna stay in the ward. You will be in gynae ward, you will be in antenatal ward, you will be in postnatal ward, you will be in labor ward, you'll be in emergency, you will be in acute emergency for gynae, you will be in theaters for elective gynae stuff, you will be in clinics, you will be in elective C-section list. So it's a dynamic field. I'm not saying you have to cover all these things in a day, but every day is different. Your morning and afternoons are different, your own calls are different. You should be committed to those things when you're jumping for obs and gynae. It's about teamwork, because it's covering a lot of things. It requires a lot of teamwork with you, your seniors, your juniors, your midwives, your community staff. So it's a lot of about teamwork. So if you have those skills, only then I would say go for obs and gynae. But I'm not discouraging anyone, but I want to make sure that you understand what it requires to be in obs and gynae. You should be good in teamwork. You should be able to commit for those things. Your communication skills are very important wherever you're working. These are the keys for your job, because teamwork requires communication skills. Again, it's about basic skills. For example, you're starting your GPST1 and you're starting in obs and gynae. They're not requiring you to do sections on your own. They're not requiring you to deliver a baby on your own. They're not requiring you to do a forceps delivery on your own. And that are the skills which are assessed in your interview as well. They're not asking for ST1 to be pro in delivering babies, but they are asking is, for example, there's an emergency like PPH, ectopic pregnancy, or anything. You can do the basic stuff. You can identify the risk, you can identify the problems, and then you can work accordingly in a team, in a efficient manner. So these skills will be assessed when you're doing your interviews for obs and gynae. Although interview for ST1 or interview for F2, interview for non-training job. The thing I like about obs and gynae is a very senior supportive job, although there are others as well. But as you know, you're doing your ST1 or F2, you're not asked to make majority of the decisions. If there's a lady coming with bleeding antenatally, you're not asked to make the decision. You are asked to assess it and discuss with ST1, ST2, ST5, junior registrar, senior registrar. Even the consultants are available, and they are very much handy. And you can ask for help from midwives as well. So it's about teamwork. It's all about communication and teamwork. So briefly about the process for application, like any other specialty, plan ahead, work on your things which are needed from obs and gynae. Two things here. One is for your application for MSRA. When you submit your application via Oriel, there is a very good guideline by Oriel where they have answered all the questions about how MSRA is, what difficulties you have about it, what questions you have about crust form, whatever your concerns are. You can always look for that, and even still you are confused, you can always email them and clarify your doubts. But do prepare crest form, do speak to your consultants. For example, I will give my example. I was doing obs and gynae in F2, and I spoke to my consultant in August that I wanted to go for obs and gynae round, and by December I need my crust form. And these are the things we discussed, that we need to have, let's say, end of life care patient to be taken care of, so he can sign me off that. And they sent me to ED, they sent me to acute medicine to get those things signed off and supervised me. So always speak ahead. Don't wait for the last minute Like you have done your rotation with a consultant for 6 months, but he never knew you're going to require a trust form, and in November we're asking him to sign it for you. There will be difficulties. So always plan ahead and speak ahead. Once you have done your application, which is probably in December, they will longlist you. Longlisting means they are checking the criteria are fulfilled. For obs and gynae, criteria is just the trust form, and you are not more than 24 months in obs and gynae, and they will be asking for references for your previous jobs. Once the long listings are done, they will invite you for MSRA exam. It's more likely the other kind of exams. There are two parts. One is clinical, one is situational judgmental exam. You can use many resources for them. All of them are pretty good. It's just to understand how the exam is and how you are going to score for the exam. For obs and gynae, only 33% of MSRA exam scores are counted towards your final scores. So you need to kill yourself for MSRA, but you should be aware that only 33% of your marks are coming from MSRA. Other scores are you going to cover from interviews. With MSRA, you can use any kind of resources for your situational judgmental. They are different. They are same for everyone. Like a GP trainee and me, we're giving the same exam on a day, but we will be scored differently for that. I will be counted 33% of the score, and for them it will be different pathway. So many specialties are having MSRA on board, but they are taking the scores differently. MSRA exams and prep, they're like any other MCQ exams. You should be quick and efficient. They are about basic skills, like any F2 level job. You should read about those stuff. You can use any Oxford resources, any other resources. It will be fine. After the exam, you will be shortlisted for interviews. So once your scores are out, either you fail if it's very low score and they're not meeting the criteria, either you'll stand very high in your scores and you will be bypassing the interview pathway. They did it in COVID, but I'm not sure what they're going to do in next rounds. So only the uppermost scores, they just bypass them from the interview process and they just pick their preferences. We get shortlisted, and then you have been sent an invite for interview. Now with interview, I'll just emphasize a couple of things here. With interviews, they were online on Teams, so we were not required to present any portfolio that time. I'm not sure if they're going to do face-to-face. Will they do that, or they will just ask for any evidence for whatever you speak in interview? With interviews, I prepared it from one of the obs and gynae senior. She has prepared a very nice media file where they have put up scenarios how you will be assessed in interview. But you can read about any other good interview book. It's just about your normal interview skills. In interview, there were two major parts. One was I was assessed clinically, which is called clinical prioritization station. You will be introduced to the consultants. There will be two of them for the interview panel. One will be actively in touch, in communication with you. The other one will be silently observing you, but both of them are marking you for that. For the first round, it was clinical prioritization. You were given a minute to read about a slide where they have given 5 different scenarios, and then they told you who you have on call with you. For example, they told us that, for example, you have an F2, a medical reg, your senior is on board, and you have different patients waiting for you. In terms of prioritization clinically, how do you prioritize them? And you need to give your management and reasoning as well. After 1 minute, they will just put timer on and they will ask you to speak about it. You won't listen from them. You won't have any feedback from them that time. You just speak and justify how you're going to prioritize them, what resources of help you are going to use, and how are you going to manage them. You'll just speak by yourself, and it looks pretty odd, but after 6 minutes, they will give you a hand and they will mute your mic off. You will be scored on that. I think roughly it's 30 scores, if I'm not wrong. After that, you will be directed towards the consultants, and now your self-assessment station is where they usually check your portfolio and other things. But because it was on Teams, they didn't ask me to present any logbooks, any sort of things. But what they asked was, they will be asking you, they will be scoring you on different things, and this scoring system is available on the links which I will share in my last slide. You'll just read about how they're going to assess you for obs and gynae. The first thing they assess you on is commitment to specialty. As I was saying, that there's a high dropout rate, so you need to be sure why you want to do for obs and gynae, and you need to convince those consultants. So they ask you, why obs and gynae? So you need to be good at what you are asking for. It's not like, it's just like that, I like obs and gynae. Why do you like it? You need to explain those reasonings, and you need to explain to them how do you understand the system in obs and gynae. There are certain things which you can show as your commitment to specialty. For example, if you have done any MRCOG Part 1 exam, that can be shown as your commitment to specialty. If you have done any obs and gynae job, that can be shown as a commitment to specialty. If you have done any audit related to obs and gynae, if you have given any other interviews in obs and gynae, anything, you can show it as an attachment to your commitment to specialty. Even though I did give my MRCOG Part 1 exam before I entered in MRCOG in obs and gynae training, I failed that exam. But when I said that I attempted that exam, they were very happy that it shows towards your specialty commitment. After that, this is the most important bit, because you are giving your impression about obs and gynae there. They'll ask you, what do you understand how obs and gynae training is? Now here they are assessing that what is your understanding about obs and gynae pathway. You need to be sure it's 7 years. Year 1, year 2 is what, year 3 what they ask you to do, year 5 what is required from you, year 7 what is required from you by the end of your year 7. So they are understanding, they are just assessing that, do you understand the system, are you ready for obs and gynae? So read about those stuff. That's why I'm always saying that read about it, what you want to do, and do your homework. After that, they ask you, have you done any quality improvement products, any audits? If you have done so, they'll ask you to explain briefly whatever you have done, and is there any recycle, what do you understand by audit, how they're going to help you. And the last bit was that after all of that, any teaching experience you have, because in obs and gynae you are a junior level and a senior level at the same time. For example, if I'm a ST1, I'm senior to my F2s, but I'm junior to my ST5. So I should be good in terms of teaching and communication skills to my juniors. So they always assess you for teaching. So they ask you that, have you done any teaching experience? Doesn't require to be very high level of teaching experience. It just asks you that, have you ever done it? What is your understanding about it? And that is a very good impression. If you have done any feedbacks from them, you can always say, I did some, because I did some teachings, and I said to them that I have done some teachings and I have some feedbacks from my junior on my Google Forms. I can always show it to them, and they were very happy, and it is always a positive feedback for me, and they were very happy about it. It's quite, I think, 10 minutes or 5 minutes round. They won't give you feedback, they will just ask you questions. After that, you will be done with your interviews, and after a couple of days you'll hear back your interview scores. Now with interview scores, you need to pass both of these rounds, with clinical prioritization and your self-assessment as well. But if they have any concerns from you about your clinical prioritization, although you have passed your other round, they'll fail you. So clinical prioritization, if they have any concerns that this doctor is not safe, this doctor is not good in communication skills, they don't know their resources, they'll fail you. So be sure it's just an F2 level kind of stuff, but you should be good in your communication skills. I got my scores. You should have at least 50% of the scores to pass it overall, but pass both of them. I scored 83%. I didn't do anything in special. It was just the communication skills. And I prepared these things beforehand. I prepared them, I think I would say 1.5 years beforehand, because I wanted to go for that. Last thing is, you will be asked to put your preferences. It's just like any other field. If you want to go for any region, just put it in your preferences. If you don't want to go for that, don't put it in there. And last thing will be, you will be given an offer. I ranked 366 out of 518 candidates who were selected after the interviews. So 518 candidates selected from the interviews. And then I ranked 366, which is pretty low, but I got my offer. Now, why I have put my rank number specifically on the slide is that I didn't submit any other application. I only submitted OBS and Gynae. I didn't submit medicine. I didn't submit it ED. I didn't go for GP. Although I was told by my couple of colleagues that you're going to give MSR exam. It's one exam. You can take 2 specialties in one exam. So put an application for GP as well. I was like, what if they offer me for GP and I don't want to go for it? It will confuse me. So I didn't put any applications. Not with the offer, because initially when I got my offer, it was 366. I was pretty low. I was sure I'm not going to get into it. But I knew that time that I'll wait and watch, because the 365 people who were above me, they have opted for many specialties maybe. And ultimately, they didn't want to go for OBS and Gynae. So they dropped out their offer, and then I got an offer. But by the time I got my offer, I had this impression that, for example, if I had applied for any other specialty, let's say GP, and I got my offer before OBS and Gynae, I would have said yes to GP, because then I would be like, it's gonna waste a year for me and a lot of struggle. For last 6 months, I have been on my desk and sitting and preparing for stuff. So I was like, thankfully, I didn't go for any other specialties. I waited. I was patient. I got my offer. But it will mess up things if you are not sure. I would say do a taster week, do some chat with others, and then go for any specialty. But it will confuse you, trust me. But it's not impossible. You can see with 366 competition ratio of 3.37, I went for it. My MSRE scores were not very high. They were just average. I passed it, but they were just average. And my interview was good. It was 83%, and with leftover 66% score was from your interview. So I went for my interview, which was good. The last thing is,
oh, sorry, you're finishing off. That's fine. Thank you.
Yeah,
sorry.
Just the links. So a couple of links here. One is for my blog, medhelpers.org. I write a couple of blogs there about OBS and Gynae and in details about MSRA and my experience. The second is for our OBS and Gynae training group, if you have any concerns. Last one is for myself, if you have any questions. And the 3 bottom ones are for training ground application things. If you have any concerns, you just go on these sites and do your homework. I'm pretty sure all of your concerns will be answered there.
Thank you so much.
I think I have run out.
Yeah, don't worry. There's a lot to cover there, and you know, I think you covered it really well in a really simple way that people are going to hopefully take a lot away. And it wasn't just, you know, do this, do this, do this. Your own story, I think, added a lot of value to it. So yeah, thank you so much. There are a lot of questions. We're conscious of people having a break, so we're just going to pass them across to you if that's okay.
Yeah, that's fine.
And hopefully we can get some individual answers for them, because there are some questions that I think you can help quite a bit on, actually. But yeah, that was really, really good. Pooja, anything that you want to end on?
No, I just want to say thank you, Shaista. It was brilliant, really useful, and you really explained the points well, that not to lose hope, to prepare well in advance, and to be intelligent about your application as well. So yeah. You know, that's really useful points. I've allocated a few questions to you. It should appear in your question box, so we'll leave it like that. But please, guys, as Dr. Shaista said, please check out her blog. Please, you know, read all the material she puts out there, because she does do a lot of useful things for IMGs as well as OBS and Gynae in particular. So please check out her material.
It's all in the chat.
Yeah,
so the blog's all in the chat. The blog's all in the chat. The Facebook group's in the chat. So please do click on those, and you should be able to find them quite easily. Awesome. Thank you, Shaista.
Thank you for providing that opportunity.
Thank you.